Right. Season greeting to everyone. Since I have problem with my phone, I found it difficult to drop a video, and this is the continuation of the next episode of Benefit of Learning. And then I want to quickly say something very important. Today we'll be talking about two things that has to do with the benefit of learning under the personal benefit that it can serve you, the benefit that it can serve you personally. So we'll be talking about two things because this benefit of what is it called learning is so broad that you cannot just say everything once. Are you getting the point? And it's so broad that if you want to say it little by little, one by one, we will not leave that phase or that team for countless days or countless months. So we have to make sure that we collaborate. We join two or more tips. We join two or more beneficial factor, and then we treat it to the core. That's how we can do it. That's just all. So today we'll be talking about two things, and the first one is self-confidence, and the other one is critical thinking. So self-confidence and critical thinking is one of the personal benefit of what academy or personal benefit of learning. You understand these two things because they are coming from a very simple phase, or they are coming from a very simple tips. First and foremost, self-confidence. Do you know that when you actually study, it can actually grant you the self-confidence of speaking in a public area? I have discussed this before. That is why I have to merge it with thinking. Critical thinking. That is to say that learning actually enhanced critical thinking. I get the point. So what we are after here now is that first and foremost, let's talk about how it serves a great benefit to our personal life. Talking about what is it called self-confidence. Do you know that if you actually know the particular definition of energy, for instance, as the ability or the capacity actually of doing a particular work, that is the layman definition given to us in our secondary school level back in those days. So when you know this the particular definition, for instance, or as a case study, then you are in a hall or in a congregation where they ask you, please, who know the definition of energy? Then you won't hesitate to stand up and say, I know the definition of what? Energy. I getting the point. So they said, go ahead and say or tell us the definition of energy. Due to the lesson you have acquired or you have learned so far, then you boldly stand up with confidence. Hope you understand. Then you die your phobias and stand up. Okay, what is it called? Energy is the ability or the capacity of doing a particular job or doing a particular work. I getting the point without stressing yourself because you already learned this thing. I get the point. You already learned this thing. I know how it does, how it goes, how they behave. So all you have to do is not just go there and say, okay, this is how energy is defined, and these are the scope, the rules that surround the definition of energy with confidence and less phobia. I getting the point with less fear because you know what you are saying, that you are reading with the respect or for context of normal studying, not out of context. Because according to some books, you see that they certain there is the ability to do work. So you saying that is the ability to do work, it's not a big deal. It's not the first thing. So you get the right thing, and you actually be applaud. You definitely be applaud for what you have done so far. Are you getting the point? So that is the first reason why and what is it called? This academic stuff or learning is beneficial. It serves as a personal benefit when it comes to self-confidence because you can actually speak anywhere, speak what you know or what you have learned. Or for example, let's talk about skill acquisition. You acquiring a particular skill when you are, you are. Let's assume you are a trainee, a novice for that matter, and then. You are learning a particular job. Let's use medical field as learning as a case study, or medicine. You are learning medicine in one pharmaceutical industry. Then, as you are learning these drugs, they say they are particular. They will say, okay, oh, this diclofenac is non-steroidal anti-inflammatory drugs, which can actually that when takes excess. Hope you understand. When take excess due to the excess acid production that comes out from non-steroidal anti-inflammatory drugs, it can lead to or arise the ulcer. Are you getting the point? Now this one is coming out from a medical preview that you taking excess of non-steroidal anti-inflammatory drugs all the time you take consecutively, consecutive hours of taking that particular, or can we say consecutive days of taking steroidal anti-inflammatory drugs will actually secrete a lot of acid. I mean, to actually produce a lot of acid that will hurt your stomach lining. I getting the point. That will hurt your stomach lining. I know what I mean. When your stomach lining is injured, being it the pepsin or the duodenum, then you have a greater chances of getting peptic ulcer or duodenal ulcer. So these are the things you have to understand, that okay, when it comes to the fix of health stuff, you already know this thing. I know what you give. So if somebody came to your store now and said, or come to your pharmaceutical industry and you prescribe paracetamol, or you give the person let's say levofloxacin, ciprofloxacin, azithromycin, or clarithromycin, anyone, those are is antibiotics. We are not talking about analgesic or antibiotic here now. I get to the point. So you now give to the patient, and the patient return complaining that he has some hurt in the chest, pepsin, he has some hurt on the pepsin, or he has some hurt on the duodenum. Just know that it's not because of the drugs you give. Are you getting the point? Be bold about what you are saying. That okay, your drugs don't cause ulcer. You give antibiotics drug. You actually give antibiotics. I'm not in a said. I getting the point. You give and macro. We see one thing we have to understand, that know the kind or the strategies, the area, the categories of antibiotics you give. Then you come again and know the particular the categories of that same antibiotic that you actually give. Then you compare it to the NSAID. Okay, me I do not give NSAID. Are you getting the point? I not give analgesic or antibiotic, because analgesic, antibiotic, and most of them are NSAID drugs, non-steroidal anti-inflammatory drugs. I did not give this one. Are you getting the point? So your mind drugs is not the one that caused this thing. So if they said they want a further investigation or interrogation, then you go there and clarify yourself. You see the point. So if you clarify yourself and said, okay, oh, this is the drugs I give and this is the mode of action, because before you be a learner person, I've been graduating from Innovance to be a boss of your own self. When it comes to this medicine line as a case study, you might have learned everything. You might have learned the indicative aspect of any drugs at all, the pharmacology, pharmacokinetics, then what is have to do with the pregnancy and as well lactation, you will know this one. Then after that, you know the side effect, you know the pharmacology core aspect of it. So after you knowing all this, there is never a way error will arise in your own hand, because you will be able to control it as a renowned medical practitioner. That's just it. So in the next video, we will actually conjoin critical thinking with another one. That's how we do it now. Critical thinking with another one. That's how we'll be doing the video, so that the benefit we are trying to list will be much for us. I mean, we do it on time. I get in the point. So I will round up on time. If not, this is how we'll be delaying ourselves. So I want you all to make sure you follow up, so that you will see the end of the episode, of all these things. We are trying to do benefit of learning, so that you will know that when you are learning, you are not learning for in vain. You are not learning in vain. You are learning for something great and beneficial. So thank you very much for being with us.